我知啊，但係你唔走得，等佢第二個翻嚟先好嘛？佢哋翻緊嚟啦，而家。佢哋去邊度啊？佢哋？去咗新界佢哋。謝偉俊就喺將軍澳，佢啱解軍翻嚟。邊個先嚟㗎 ？Alan 話。毓民有冇嘢問先？有。你問先好嘛
？Right. If you're ready, I can give you the floor. You can start with 2.51.
我係問完啦。
即係2都仲未講完喎。
嚇？社
區照顧嗰度未講喎，3嗰啲都住宿照顧嗰啲又未講喎。
係啊，係。多謝你局長，唔好意思要你聽下，因為要有3個人先夠呢個法定人數。OK， 清楚。如果你要咖啡茶，佢哋可以俾到嘅呢度。
清水得啦，主席，多謝。
好，我哋而家可以開始啦。毓民，你可唔可以話俾我聽你去問邊個問？
我問你。
Can you tell us where you are? I start with 2.30, Enhanced Sport Play Scheme. Now, according to the audit report, the SWD in the previous financial year spent $673 million on EBPS. As at the end of March 2014, among 121 RCHGs participating in the scheme, excluding the 14 RCHGs which had involved plays, purchase, and case intake by face, 39 or 32% could not achieve the 92% enrollment rate. Among them, 13 RCHGs had relatively low enrollment rates, with 10 of them having an average enrollment rate of 50% and 80%, 3 below 50%. On average, some 550 to 590 of the 766 EPBS places had remained vacant in 2013-14 and 2013-14. With regard to low enrollment rates, is location the main reason? Have you conducted any review on the low enrollment rates? The director or the secretary? Now, if it is not the director, then the secretary can answer. The director. Let me explain why it's below 50. At the end of 2014, 4 were below 50%. They joined the scheme rather late. They joined in May 2014. And some time is needed to allocate elderly to take up those places, and therefore the usage rate is rather low. As for other RCHGs, starting from 2012, we introduced a reduction arrangement. If the RCHG cannot reach the enrollment rate of 92%, when we renegotiate the new agreement, we will cut the number of places to be bought. Now, under the new arrangement, 25 of our RCHGs were subject to reduction in 2014 to 2016 purchase agreements. We still want to have subsidized or subvented places so that more elderly can take up such places. If these RCHGs are able to reach 92%, then we will increase our purchase. And there is a new arrangement. And when we see available places in RCHGs, we will make full use of them so that we can provide respite service. Now, there are carers of elderly who may want a respite service so that they can put their elderly there for a short period of time, and they can therefore free themselves to attend to other urgent businesses. And we've already started that. According to the Audit Commission, 2.26, 2.27 of the report, they are unable to reach the number of places. They are not able to maintain the number of places. At present, there are only 1,276 places. And in 9 years' time, there will be an additional 2,000 places, subvented places. But every year, there are 5,000 elderly who pass away before they can be allocated a place. So you cannot bring relief to the situation. Only a few participated in the provision of residential places. Do you can you find out the reasons that they are unable? Other NGOs are not able to join. We understand Mr. Wong's concern about the 16,000 or so planned places. We also have a special land scheme. Now there are about 9,000 places. We expect that the 7,000 will be available in Lam Tay, Pok Oi Hospital. Will make use of the lotteries fund, and they have got through the town planning board. Within a few years, there will be 1,405 places within 3 to 4 years' time. Before the finish of the term, they will put up the superstructure, and starting from 2017-18, it will commence service. Now, we can see that within 3 to 5 years, there are 7,000 places available. We'll continue to work hard on that. We are not complacent. You're talking about 2017 and 18, right? But you are not able to cut the queue. So more will be added to the queue. And the longer their lives, the more the waiting. Unless you ask people to sign an agreement to kill themselves at the age of 65. The elderly is a burden to you, and the elderly are suffering. It's not that in 2017 we have more places with more bigger targets, but there is a long queue every year. 5,700 died. In 2014, 15, maybe 6,000 died, or 7,000 died. Why other NGOs are not able to participate, and why the participation rate is low? You have to get the help of other NGOs. Why the participation is so low? The director. As for EBPS, those on the CWL who want to join, who want to go into EBPS is very low, just 5.9%. In the private sector, there are vacant places in the private sector and also in the self-financing sector. The vacancy rate is as high as 24%. We are seeking resources to enhance the number of subvented places. We should also make use of market forces and get involved more service providers. In the past 2 years, we try to enhance the quality of the EBPS. In 2014, we've made reference to the pay level of subvented institutions and also the rent of different places. We adjusted the level of subvention or level of board place. We have A1 and A2 places, and all new board places will be of grade 1 or A1. and we hope that all A2 RCHEs will be upgraded to A1 RCHEs. Then there will be more places available. And this morning we said that there is a new approach. There is a residential care voucher. A study is now being conducted by the Elderly Commission. Now, when the scheme commences, then those who have the voucher can use the voucher to stay in private homes or board place homes. We are trying to get as many places as possible through various means. Within a shorter period of time, we hope more places can be provided. Chairman, there is an acute shortage of residential places. Waiting time is long. Supply is lagging behind demand. The Audit Commission has found that the allocation and enrollment arrangements are not efficient, and there is wastage of resources. In paragraph 3.24, concerning RC 2.34, concerning the late reporting of discharge cases by RCHEs, the most serious is 2 years after discharge, the RCHE reported the case. And there is no time pledge set for SWD placement referrals. Are you aware of these problems before they, or were you aware of these problems before they have been exposed by the Commission? Concerning the cases mentioned by the member, there is a human oversight. You discovered that after the report of the Commission or before the Commission, it was exposed by the Audit Commission. Before it was exposed, had you found it out? Before the Commission report through our staff members, we checked the name list of residents in the RCHEs. The names of the residents are changing all the time because there were people moving in and there were people moving out, and we didn't discover that. On the 28th of March, we checked the name list again, and we discovered the problem, and we asked the RCHE to make further report, and we've done some changes.
We have informed all RCHEs on the proper way to notify us, and we have also introduced a new system. Once we receive a notification from the RCHE, we would also give them a confirmation in 3 days' time, so that both sides know where they stand. Actually, there's no need to make improvement. That's the manual. You just follow the manual procedure. You have no one to supervise the RCHEs. It's said that within 2 working days after a resident has left, there's the need to notify the SWD. But there were 300 cases whereby the RCHEs were reported as normal discharges, and they did not came within 2 working days. And in 50 cases, discharge cases, the notification was made after 7 days after of the discharge, and the RCHEs could not explain why. So what's the purpose of the manual? The manual is just something in writing without effect. We have we have a severe acute shortage, and then there are people waiting, and they sometimes notify you in 7 days, sometimes in 2 days, And if someone was unfortunate enough, they would die while waiting. Well, you are slack in your supervision of the RCHEs. Well, we're not going to blame the RCHEs. In those cases, as I said, we were found wanting. The RCHEs did notify us, but our office staff somehow failed to notice the report. The RCHE thought they had informed us, and we were unaware of the notification, so something was missing there. So the manual was really not very useful for you, because the Audit Commission did find out those cases. They are not experts. They carry out an audit, and they know how many people have been discharged and how many vacancies were already in existence. Director, since you have accepted the audit report, you may just simply admit that you are in the wrong. You did not follow the manual, and now you have tried various means and ways to improve, or you are trying to make further improvement in due course. Maybe that's one possible way of answering the questions. Maybe you should confirm that the manual was not complied with, because you have accepted the audit report. Maybe I give you another chance to give it another try. Actually, we have already said that we agree with the audit findings. But you say that the manual was not enforced or complied with. I think that was more a case of miscommunication. But there's no need to argue. If you did comply with the manual, there would not be any miscommunication. There was miscommunication because you failed to comply with the manual. I think the audit is very clear. There was no evidence indicating that the SW had taken up any follow-up action, for example, seeking explanation or issuing advisory letters on the belated reporting of the discharge. It's very clear. Yes, there's no need to argue further. You have to make improvements. It's okay that mistakes were committed. We have to look forward. We'll criticize you. That's of course something we must do. But we all want to see improvement. Another question, 2.49. Underutilization of AQ places. 1,812 AQ places. This morning, Mr. Alan Leung asked a question about this. Maybe you want to follow up? Maybe from a different angle? The 1,800 AQ places were not allocated through the central waiting list, but they were fully subsidized by the government. How were those AQ places allocated, and how were the RCHEs monitored? Were they required to submit regular reports? The question raised this morning was about another aspect. Director, how were those AQ places allocated? As I said this morning, in 2004-05, there was a study by the ICAC, and then we came up with some arrangement to ensure fairness, transparency, and proper monitoring of the allocation exercises. The NGO, the RCHEs have to comply with certain rules in allocating these places, and they have to report to us. So that's how the places are allocated. But how do you regulate them on a day-to-day basis? How do you monitor their operations? Because they are fully subsidized by the government. But how do you monitor the operation of the system? I explained this morning the legacy with regard to the full subsidy by the government, so I won't repeat the points now. As for whether there are vacancies and how many vacancies are held by these NGOs, well, we have proper records about them. whenever there are vacancies, as I said this morning, we'll ask them to provide to offer some places to those on the central waiting list. And the RCHE and under the transformation arrangement, we would recover those places once after they have been transformed, and then the places would be plowed back to the central pool. Thank you. I think that's all for my part. Do we have Mr. Chen Ken? Mr. Leung? I have a question about 2.34, paragraph 2.34 in the audit report. We know these subsidized places are funded by taxpayers' money, 70,900 to the 15,600 per month. So that's the kind of subsidy they receive from taxpayers. And how many cases of belated reporting have there been on the part of our CHE on discharges? And there's no time pledge set for SWD placement referrals. And sometimes the allocation was done belatedly, and some RCHEs report temporary discharges too late. And they don't have a set mechanism to deal with belated reporting of vacancies. And there's no penalty for later reporting. So, because of these shortcomings, we have a situation whereby there are vacant places, and on the other hand, there were 30,000 waiting list applicants. So this is most unacceptable to me. All in all, what we can see is that the private RCHEs are doing it slowly, and the government is just spending money, pouring money down the drain, and the elderly applicants suffer at the same time. In 2.34, there are 5 so-called anomalies. And do you agree that these are really not acceptable, Director? From a value for money point of view, how do you make sure that each and every places where we subsidize $7,900 to $15,600 a month will not be money pouring down the drain without achieving the intended purpose? What are you going to do to plug the loophole? Chairman, I hope, well, we are always fair. When we write up our report, we will also include measures to make improvements, because we do want to inform taxpayers that the wastage will no longer continue. Secretary, I will ask the Director to supplement in a moment. I agree that this is most undesirable. Do you accept those anomalies? Of course not. It's not ideal. Yes, we need to plug the loophole, but to make sure that the places will not be left vacant for some time and we are kept in the dark. The Director will tell you something about the measures that we have taken to handle these cases. Yes, we do not accept this situation, and we have introduced measures to improve. Before you come to that, maybe you can give us some numbers. How much money? How much was the money that went down the drain? It would be better if you can tell us the amount. But if you don't, well, let us know that you don't. Well, I don't have the figure. Well, in the whole work process, there are time limits. For example, 1 month after application, and then 6 days after the consent has been given, the worker will have to hand in the consent, and when there's a discharge, a report will have to be made within 2 days. If the elderly resident leaves Hong Kong, then it has to be reported within 2 months. In the audit report, there are some extreme cases uncovered. Maybe I can give members more information regarding the reasons leading to those cases. For example, referral has been made, and the residents took a long time to move in, not within 2 weeks. In some cases, when it's time for the resident to be allocated a place, he or she falls ill or has a mental problem. For some, the X-ray shows that the resident has a problem, and sometimes a doctor, a psychiatrist, has to be consulted first. And so we have ended up having cases of wastage of RCHE places. In the future, when we encounter similar cases, we would adopt a new approach. Maybe we should be more determined, or to be more decisive in allocating the place to another waiting list applicant. We're not asking you to be so-called decisive. Yes, we need to come up with a mechanism in dealing with such cases. When can you tell us the mechanism? Before or after we write our report? I think you have already got the report for a long time already. You have accepted their recommendations. Can you please devise this mechanism as soon as possible? Yes, we'll do that as soon as possible. Can that be made available before we write the report, our report? Maybe you can just give us a framework. Yes, we can tell you in which direction we intend to move. Mr. Leung. Next, I want to talk about the improvement to the board place scheme. It's paragraph 2.30 in A. As at the end of March 2014, among 121 RCHEs participating in the enhanced board place scheme, 39 RCHE could not achieve the 92% enrollment rate set by the SWT. Among them, 13 RCHEs had relatively low enrollment rates, with 10 of them have an enrollment rate between the 50 to 80% and 3 below 50%. On average, some 550 to 590 of 7,660 EBPS places have remained vacant in 2012 to 13 and 2013 to 14. From this paragraph, we know that these 13 RCHEs apparently were not popular. According to the director, there's a monitoring mechanism. If you do not do well this year, the next year, you will be subject to some penalty. But if these are so unpopular, especially we have 3 with an enrollment rate under 50%. Why don't we just disqualify these 3 RCHEs from the EBPS? Why did you drag your feet at this? Well, we are talking about as the end of September 2014, there were 4 with an enrollment rate of 50%. They only joined in May 2014, so they would need some time to raise the enrollment rate. because the allocation is done in terms of the waiting list positions. It's not that the enrollment rate have been under 50% on a prolonged basis. We wouldn't accept that. As for the 92% enrollment rate requirement, we have this reduction mechanism, place reduction mechanism since 2012. If they fail to reach this target, the number of places bought will be reduced. Chairman, a reference has been made to the place reduction mechanism if they don't meet the target enrollment rate. How many years would it take for the number of places to be reduced to a number of places bought to be reduced to 0, and that is you turn to other RCHEs? You have a policy on bought place scheme, right? When we buy the places in the market, we look at the quality, the manpower, the space provision. That is the quality of the RCHE. Well, we are not going to tolerate low quality just because we need to fill the numbers. As for whether the number of places will be reduced to 0, as we discussed this morning, whether we're talking about subsidized places or bought places, there are a turnaround time. So we require the enrollment rate of EB, PS, RCHEs to reach 92%. We'll make sure that the reduction would mean that the enrollment rate will be up to 92%. We're not going to reduce it to 0 immediately. Although we buy places from the RCHE, we would also want the RCHE to be up to a certain quality in the entire RCHE. But some elderly applicants would like to have, would prefer subsidized places. But for bought places, they account for some 40% of those who are newly qualified in the central waiting list. So we continue to seek quality improvement of these EB, PS, RCHEs. According to the director, the 3 with enrollment rate under 50%, they only joined this May, so we need to give them some time to improve.
But there were 10 RCHEs which did not do very well. Did you try to find out why these 10 RCHEs did particularly bad in terms of enrollment rate? Were there anything wrong with their facilities, or were the quality not up to standards? Did you try to analyze the cause, Director? Chairman, we have records of specific RCHEs, but it's not that some RCHEs were doing very bad, because if they are to join, to be part of EBPS, they must satisfy some of our requirements, including manpower and the number of beds, etc. But for some RCHEs, the enrollment rates might be low because of different factors, such as location or transportation, and sometimes these are decisive factors. We will step up our promotion efforts in order to encourage our elderly people to be more accepting of different RCHEs. In terms of cost effectiveness, you said some RCHEs are inconvenient, etc. Would you consider putting your money on RCHEs which are more popular? So the Secretary said that you won't just blindly tolerate RCHEs despite the quality. So why don't you instead put your money on the more popular RCHEs. Director, as I explained earlier, that's the way we are going. In the past, we have chosen RCHEs in our EBPS, and this way we can better make use of our resources. You won't buy from less popular RCHEs, right? And you're buying more from the popular RCHEs, is that right? Work is ongoing. We constantly monitor the RCHE places, and we would adjust our portfolio accordingly. Is there a specific cycle? How long have you been? How long is the monitoring period in which you decide which RCHEs to buy from? I'm still not very convinced how you actually monitor the RCHEs and how many years would you give them, etc., before you say it's enough and turn to another RCHE. Is the methodology scientific? In terms of cost effectiveness, we have to we need results according to paragraph 2.30, paragraph A. You said some 550 to 590 had remained vacant. Looking at this figure, it's rather not cost effective. Can you make it clear to the PAC if your monitoring mechanism is effective to make sure that public money is well spent? We want to make sure that we are investing money in RCHE places that are useful to the elderly. Our practice is, let's say, if we buy 50 places with an NGO, we would sign a 2-year contract with them, and we have a regression mechanism. They would gradually take in elderly people, and 2 years later, if they don't meet the 92% mark, we would cut the number of places. So that's stipulated in the contract. If we buy 50 or 100 places, we do have legal requirements for the RCHEs. For every 100 places or so, then they need a specific number of nurses, and as such, they can make the appropriate manpower deployment. And if some places are left, even if some places are left vacant, they still need the necessary number of staff in order to satisfy the requirements. So that's the mechanism we have in place. After the 2-year period, if we see that a lot of places are left vacant, we will sit down and talk with the RCHEs to see if they need to step up promotions in order to encourage more elderly people to come in, etc. So we do have a mechanism in place over the course of 2 years. Well, let's just talk about the example you just said. After 2-year period, are you going to give them another 2 years? And after 4 years, if they're still not doing well, are you going to give them a further 2 years? So this is something I want to clarify. Can you provide any statistics so that we know how the public money is spent? Well, I'll try to explain it in a more scientific manner. Yes, I understand you want actual statistics. We have a 92% enrollment rate requirement for RCHEs, and after a 2-year contract, if they cannot meet the mark, we will reduce the number of places until they meet the 92% mark. Let's say if after the reduction they did worse and still cannot meet the 92% mark, we will reduce it further. We are not going to say we will cancel the program altogether, but we will keep reducing the number of places they can offer until they meet the 92% mark. So that's the quality standard we impose. And we continue to monitor their performance. The question was, 2 years later, even if you continue the monitoring, you will continue to pay, and 2 years later, maybe the same will happen, and it might go on for 5 to 6 years. We are talking about public money. So do you think this is acceptable? We certainly do not accept the situation, and that's why we have the regression model. And in the second contracts, we will reduce the number of places they provide until they meet the 92% enrollment rate. And if they have a lot of vacancies, we will reduce the number of places. And if they do even worse, we will reduce it further until they meet the 92% mark. So we are talking about elderly people who require long-term care. So it's not a complete wastage. Chairman, scientifically speaking, we won't see a lot of very extreme cases. But let's say if you buy 100 places from an RCHE, during the first contract they have 80 places, and maybe you will reduce the number of places to, say, 85 until they meet the 92% mark. Let's say if we have an elderly person who is being ignored by his or her family, if you are to meet the 92% mark, that person would have to suffer for a lot of years. So are we really being that stiff or stringent? I understand your scientific logic, but let's say if we have an abandoned elderly person, and if an RCHE is doing very bad and the number of places is ever decreasing, but under the existing mechanism, that elderly person would still have to suffer for 5 or 6 years before he can be reassigned. So that seems to be a loophole. After the director made her comments, I have something to add. Chairman, Mr. Leung mentioned that scenario in which the quality of an LCH is going down all the time. For A2 and A1 grade LCHEs, we have very clear requirements in terms of manpower and space. If they fail to all these requirements, we might prosecute these LCHEs. So this is something this is not about the contracts. It's if the quality is really so terrible, then they would not have met our requirements at all. And even if they cannot fill up all the spaces, let's say if originally we bought 50% of places and subsequently only 40%, and we will reduce the number of places gradually until they meet the 92% mark. We will not just cancel all their places. Chairman, I want to add something. In the audit report, it's a report on the situation in 2013 to 14, and we have 590 vacancies. And since April this year, the situation has improved substantially, and in April we only have a lot less. We had a lot less vacancies. We only had 427 vacancies, and the increase in rent in urban areas is more than $2,000, and we have 2 registered nurses. And for A1 grade, the area is 9.5 square meters. For A2, it's 8 square meters. And the enrollment rate now is 94.5%. So there's a marked improvement. Can you share the relevant information with us later? I want to add one more point. As the director said, the vacant places would be redeployed and for respite purposes. So there are 260 such places. So we are taking a dual approach. What is meant by a respite arrangement? It's provided on a day-to-day basis. Let's say if an elderly person's family members have to travel to China, what happens to the elderly person? And that person can use the respite service for a matter of days or even a few weeks. So we are trying to maximize utilization. So can you provide the relevant figures? I want to talk about community care services. Well, I had 2 questions, but doesn't matter. I want to talk about Section 3 on community care services. On the the report has made it very clear, and there are a lot of figures. A lot of auditing is based on the SWD guidelines. They weren't. The report was based on the guidelines instead of sensible logic. And we've been talking about long waiting times, inefficient use of resources, etc. That seems to be the practice for all government departments. Like some basic infrastructure projects have over-budgeted, and we are overspending, and we have spent hundreds of millions of dollars in fresh water, and we are throwing a lot of money down the drain. And it's the same for the aviation department. And according to SWD, service providers usually have to receive cases within 7 days and provide services to the elderly. And from 2013 to 14, the SWD analyzed cases for users of community care services. So there are 2 tables. I'm not going to repeat myself. And 7, it refers to 7 days plus 2 days, and 52% of the cases were handled within 15 days, and 48 plus 52 makes 100%, right, Chairman? You mentioned 7 working days. The reception of elderly people did not actually follow the SWD guidelines. Well, 7 working days plus 2 days makes 9. Did you ask the SWD why they had to spend up to 15 days to receive elderly people instead of 7 working days? So is there something to do with the lack of monitoring or lack of manpower? Director, perhaps Ms. Lee can give more on the SWD procedures. In some cases, the time frames in the SWD guidelines were not followed. In those cases, the NGOs could not contact the elderly people or their family members. So that's the reality, because at the end of the day, we have to first approach the family members. Sometimes they might be working or out of town. and some elderly people were sick or they left Hong Kong for a period of time. And we are talking about daycare centers. Some elderly people suffer from dementia and they were arranged to daycare centers. And in terms of escorting or transportation, well, there are some constraints which mean that NGOs cannot adhere to the 7-day requirement. Under paragraph 3.14, we spent a lot of time for this case, and at regular intervals we asked the NGO to report on the progress. And this case reflected all the procedures we mentioned. And the NGO had a hard time contacting the family members of the elderly person, and he was also sick. And the NGO also confirmed with his family members how daycare services can be provided. But then the family, his family had some preferences on the transportation arrangements, and this case started in March 2014, and at the end he was only arranged to an LCHE on the 8th of July. So this example actually covers a lot of possible situations. And this report, the audit report, showed that the SWD has to remain close contact with the relevant parties in order to shorten the lead times and fill up the vacancies. We will discuss with the HKCSS and other social welfare institutions in future meetings and see how we can better follow the guidelines.
Chairman, concerning the explanation, I asked whether there was inadequate manpower or there was inadequate supervision. Now, you gave the explanation under 3.12, and we are aware of that. But that is related to that institution. That is related to the SWD. After all, if you look at 2.12, the daycare, the waiting for daycare is very long. You have very limited number of places. The admission should be at a suitable time. More than 15 days, and some more than 60 days, 2 months, 100 such cases. Is it not a waste of resources? Now you also can defer the handling of the case. I think you really have to pay special attention to that. You have the responsibility. The institutions also have the responsibility. Under 3.12, the Audit Commission asked SWD asked the service provider. The explanation is that they are away from Hong Kong, they're difficult to contact. Can you give me the numbers then? Concerning contacting the elderly and family members, that's difficult. Say the person is away or hospitalized or spend time to persuade the elderly. Now please look at these cases and show us the provision, the percentage, how many of them in this category, how many of that in the other category. Give us the details. Say, for example, is it because what is the most difficult? That they are away, or they are difficult to be persuaded into admission, or what? You need to understand the nature of the difficulties. We want to know the percentage under these various categories. Otherwise, we really don't know whether you supervise the institutions and whether you follow the provisions in the manual. Concerning time spent on persuading the elderly. Now, some family members register the service before getting the permission of the elderly. This is very common. Put in the name first without the agreement of the elderly. In my office, I came across this. 2 generations. I was the middleman between the 2 generations, and I assisted to persuade the elderly. Just said by the secretary, it's better to stay in one's own home than in a palace. And you may want to say go to the park, and then you can put your pets on horses and things like that. Have you discovered these problems? Do you have numbers concerning these various categories, and what are the difficulties and the relevant percentages? Yes, Ms. Lee, can you give us the data? Yes, Chairman, we will provide the details in writing after the meeting. I just want to provide a piece of information to members. Concerning daycare centers, they are very different from residential homes. We say 100 places, it doesn't mean 100 elderly only. They come at different times. Daycare centers, the usage rate is 107%. So the places are not vacant, but we accept the criticism. We can follow some cases more closely, and we have established a mechanism. After 7 days, we issue a reminder, and if there is no return, we will issue another reminder. We require them to give us an outcome within 7 days, and we can follow the case more closely. Under 3.14, paragraph 3.14, according to the SWD manual, you need to issue a reminder, and after 14 working days, if the elderly cannot be contacted, and then the relevant case worker has to be contacted to understand the situation of the elderly. If the service provider is not able to provide the service, then the relevant document should be given to the SWD and set out the reasons. Then the SWD has an automatic mechanism to suspend the case for suspend the case of 3 months, and suspended cases will be closed if the RW for elderly do not provide any further information within 3 months within the 3 months extended periods. Now, do you have the situation in which the places are vacant and those waiting are not able to make use of the service? Well, certainly, Mr. Chairman, we will follow more closely. As for suspension, we do adopt this procedure. Say, within 14 working days after the placement referral is made, contact has to be made. Or rather, if the elderly cannot be contacted within 14 working days after placement referral, the service operator should liaise with the RWs for the elderly for clarifying his or her conditions. And for one reason or other, the elderly may not join. Say, for example, the elderly has to go to a hospital, and the hospital cannot provide a date of discharge, or the applicant is outside Hong Kong and cannot be contacted. We will suspend the case for a period up to 3 months automatically, and then the notice will also be given to the RW. Now, your communication with the service provider is very important. Now, we have the impression that in terms of community care, there is an acute shortage of places. I want to emphasize acute shortage. And you need to step up supervision, and you need to step up communication with the service provider. The problem is lack of communication or inadequate communication. They just don't follow the manual. There is no evidence that the SWD has taken immediate action to follow the case in dealing with and also suspend the case. Now, when the audit issue the report, you will say everything is okay, but we need to follow the matter up, and we don't want it to appear again. After this, we will write reports and we will ask the relevant panel. We may ask the relevant panel to follow the matter up. Now, there is they have taken a very long time to admit a case, so you really need to shorten that. In particular, the communication with the service operator is not adequate. It's not that after you okay it, we okay it. Now we still have to do our work. You have to tell us what you will do. Otherwise, we will keep going after you. What actually will you do? If you have if you have no idea, then you better go back and think about it and give us a paper, and then we'll follow the matter up. Can you give us an answer now? We've answered that. Say, for example, we have a 7-day requirement or 7-day reminder. That's our commitment. We're not talking about this pledge. We ask for more than that. I think it is about the problem of communication between your good self and the service providers or the service operators. Please go back and think about it and think about it. Please go back and think about it and give us a report, and we can discuss that. Mr. Wong Yong-man, any further questions? Chairman, can we have a break for 5 minutes? Can we go to the toilet? And I have to sign up next door. Yes, he wants to answer the call of nature. We don't have a quorum. We don't have a quorum. Okay, we have a break of 5 minutes. Yeah, we only have 3 members here. 10 minutes, okay, Mr. Wong.